Hi, I am Dr. Abhinder Singhal, Pediatric Urologist and Hypospadias Specialist.
I'm Dr. Ashwita Shanal, Consultant Pediatric Urologist at Mitra Hospital.
"20 years back, kidney stones in children were unheard of, but in the last 20 years, more and more children are developing kidney stones. A change in diet, lesser physical activity, leads to a change in the pH and also excessive mineral formation in the urine. And these are the reasons why more and more children are coming with kidney stones.
50% of the children who present with kidney stones may have a metabolic cause, such as hypercalciuria, hyperoxaluria, hyperuricemia, or hypocitraturia. In the remaining 50%, there is no exact cause, but there are certain risk factors such as eating processed or junk food, decreased water intake, obesity, or high salt intake, which can lead to kidney stone formation. The symptoms which children can present with in kidney stones are pain in the back or pain in the flank, difficulty in passing urine, burning urination, urinary tract infection, blood in the urine, or increased frequency of urination.
Rarely, kidney stones may form secondary to an infection or to a blockage of urine. If there is a block at pelvic-ureteric junction, we have seen children coming with stones in kidney. If there is a block at vesico-ureteric junction, then the stones may form in the ureter. Or if there is a block at the outlet of the bladder, then bladder stones can form in children.
Whenever a child presents to us with symptoms of kidney stone, we do an ultrasound. Ultrasound will tell us if there is a stone present, if yes, the number of stones, the location of the stone, and any associated hydronephrosis.
Kidney stones, which are actually rich in calcium, may be seen on a plain X-ray also, though it is not the first investigation of choice. Sometimes we get children who are strongly suspected to have a kidney or a ureteric stone, but the stone is not seen on an ultrasound. In such cases, we prefer to do a CT or a CT urogram to confirm the presence or absence of a kidney stone. Small stones located in the kidney, stones which are less than 6 millimeters, and if they are located in one of the chalices, often they do not cause any symptoms and we do not prefer treating them. If the stone moves from the kidney into the pelvic-ureteric junction causing a block, or if the stone moves into a ureter, then there will be terrible pain, there may be hematuria, then these stones need to be treated. In such cases, if the stone is less than 6 millimeter, we wait and watch for a few weeks. We give enough hydration, painkillers, antibiotics, and even alpha blockers, because most of these stones will spontaneously pass with this kind of therapy. But if the stone is more than 6 millimeters, then we prefer to do an endoscopic surgical treatment.
Sometimes medical management can fail in kidney stones. This can happen if the kidney stone doesn't move from its place, or if the child has extreme pain, then we may have to do a surgical intervention. In cases where the stone is large, if the stone is impacted, or there's a large stone burden, again surgery will be required.
Child is not a small adult. The instruments which we use for stone surgery in adults cannot be used in children. Hence, endoscopic stone surgeries in children have become in vogue only for the last 20 years. With the availability of small scopes, small laser fibers, practically most of the kidney stone surgeries can be done with endoscopy. For example, if there is a stone in the kidney which has a large stone burden, we try to do a surgery called mini PCNN or a mini PERC. In this procedure, first we place a ureteric catheter from below into the kidney, then we turn the patient around and we make a puncture into the kidney under X-ray guidance. Through that small puncture needle, we pass a guide wire, dilate the tract, and finally we put in a telescope directly into the kidney. This telescope is just a few millimeters thick. Through that we pass a laser fiber, breaking the stone into extremely small pieces, and these pieces are typically passed off into urine, or we remove it at the time of endoscopy itself. At the end of the procedure, we also leave a DJ stent. In most of the cases, this leads to complete clearance of kidney stones with this procedure known as mini PERC or mini PCNL.
If the stone is in the ureter, then we do a procedure called as ureterorhinoscopy, which is called URS. At MITR Hospital, Pediatric Urology Department has a small 4.5 size URS scope which can be passed into the ureter of even a 1-year-old child. A stone can be broken into multiple fragments using holmium laser and a stent is left in situ. Sometimes the ureter may be small. We may not be able to negotiate the URS scope. In those cases, we put a DJ stent in the ureter and leave it for 2 weeks and do the URS 2 weeks later. The DJ stent relaxes the ureter, makes the ureter bigger and helps us to negotiate the URS scope easily. Pediatric stones are notorious for recurrence. Even if we have achieved complete clearance, the stones can form again. If your child has metabolic disorder, then it is necessary to continue the appropriate treatment, otherwise the stones will definitely recur.
The management of stone in a child should be divided into 2 parts. One is the part about managing the stone which has formed currently and clearing it completely. Second is preventing recurrence. For preventing recurrence, we do a thorough testing called metabolic workup, which is a set of urine tests and blood tests to find out the exact cause why the stone has happened. Once we find out the cause, then the patient is managed, or the child is managed by a pediatric nephrologist to prevent recurrence. It is very important that we do a 6-monthly follow-up in an ultrasound and a very regular follow-up, even more regular, with a pediatric nephrologist so that the child does not form stones again. Up until a few years back, children with kidney stones were treated by open surgery. With the advent of modern endoscopic techniques, most of the children can be managed with extremely small incision and go home within a day with complete stone clearance. If your child has a kidney stone, please go and see a pediatric urologist, and we will also be available on email if you want to seek a second opinion from us.